Hello, I'm Julia Walters with Kingman Regional Medical Center, and you're watching our COVID-19 update series. Today I'm here with Doctors John Ashurst and Anthony Santarelli to discuss recent updates in our area's COVID status, and first I'm going to give you the numbers. In the last 7 days, we've done 543 tests for COVID-19 with 48 positive results. We have 23 patients hospitalized related to COVID-19. Today we have Doctors John Ashurst here. Thank you for being here with us.
Thanks for having me.
And Dr. Anthony Santarelli over there on the end. Thank you for coming.
Thank you for bringing me here.
So, Dr. Santarelli, I think we'll start with you. We wanted to talk about just the recent surge in cases and the Delta variant a bit, right?
So one of the major concerning findings that we're seeing coming out of the literature is the emergence and the explosive growth of the number of infected individuals with confirmed infection of the Delta variant. So I just kind of want to take a step back a little bit and let everyone here know what the Delta variant is, when it first kind of cropped up, and then if Dr. Ashurst, you'd like to talk a little bit about the clinical symptoms and what patients who do end up coming in contact with that variant will see with their symptom progression and whenever they're admitted to the hospital. I think that'd be fantastic. So the first thing that we do know, and it made widespread news, was that the Delta variant emerged in India in December of 2020, and then it spread throughout some other major countries in the world, starting with the UK and Scotland. It has made its way to the United States and is expected to become the most predominant form within the next couple of months. If you remember from our previous conversation, we talked about how one part of the virus, that receptor binding domain, is critically essential for how the virus infects your cells and leads to illness. This variant is unique as it has two specific mutations in that receptor binding domain, that motif that allows viral entry into the cells. That's increasing the transmissibility of the virus, as well as increasing the likelihood of you developing more severe symptoms. So Dr. Ashurst, if I do come in contact with the Delta virus, what can I expect to see starting from something like day 0 before and through when I start feeling sick?
Yeah, so actually this form that we are currently seeing is actually his symptoms are not the same that we saw during the past wave. You know, in that wave before, we saw people who had a cough, they were out of breath, they lost their sense of taste and smell. You know, those same symptoms we're not necessarily seeing right now. What we're currently seeing actually is basically a really bad cold or someone who has allergies. And what we see based upon the data out of the UK is actually the patients complain of that their nose is itchy, it's runny, the throat's sore, they might have some aches and pains, they have a low-grade temp. So it's just what we're seeing right now is his symptoms are much different than what we saw with that last wave.
So the symptoms when patients coming in are presenting to the hospital are markedly different, and that does kind of track back onto how the changes and mutations in this virus propagate across your respiratory system. So what we do end up seeing is that the protection from your own innate immune response is reduced by about half against the Delta variant in particular, whether or not you've had a previous strain of COVID beforehand or whether or not you've received convalescent plasma or any kind of antibody therapies. This doesn't necessarily hold true for the vaccines, and we actually see the vaccines showing still a high reliability of protection against infection, though reduced from kind of the wild type virus or the one that we all got used to. But it is showing a fairly marked difference in the rates of severe infection.
So let me ask you, are the vaccines similarly effective to the new variant, or how are they holding up?
Yeah, so how about let's first talk about what we're currently seeing in our area. So we know the data from Mojave County. It appears based upon the stats that we saw this morning, that maybe about a quarter or more, between a quarter and 1/3 of all people who live in our area have 2 doses or completely have the vaccine. And what we see with that data actually is it's mostly the age over 60 plus. what we're not seeing is anyone under that age. There's a very small proportion of the people in the ages 19 to 25, 19 to or the 19 to 65 range that is getting their 2 doses. With the vaccines, what we currently see actually is that they do have a high rate of efficacy towards what we're seeing now. The symptoms, the rate of having a symptom after you've been exposed is relatively low, as well as the need to be hospitalized. What we're currently seeing actually is that the majority of people who are in the hospital are those who have not received their complete course of the vaccine.
I know that a lot of younger people in those age groups that aren't being vaccinated are less concerned about getting COVID. What do you have to say about that?
So one of the major concerns and why it's really important for younger people in our community to make an effort to get vaccinated is that with the Delta variant becoming the most predominant strain, with its higher transmissibility throughout the community, we see the patients hospitalized throughout the UK, India, and the state of Arizona as well are largely whole familial units. So if you live with a family or a young person, the likelihood of you passing that on to a member in your family has skyrocketed solely because you exist within the same space.
Right.
Yeah, and then going along with that, so just like we were saying, is the rate of a transmission amongst people is actually much higher with what we're seeing now as compared to what we saw with the last wave. The other thing that we see is with this new with the new strain that we're seeing, the rates of being hospitalized from the data from the UK is actually much higher in a younger age group also.
Exactly. I believe those numbers ended up shaking out to an 85% increase in the need for hospitalization on patients who contract the Delta variant. Now, our current knowledge about how much that variant has penetrated into our community is still rather limited, but it has increased from about 2% in the state of Arizona to an expected 20% of all new novel infections statewide.
Wow.
Yeah, and then what we saw is that recently U of A, they did some gene testing, and they have gene tested the Delta in about 138 cases as of this morning.
So the data was updated as of this morning. It looks like they just completed a new batch. So in total, from the Mojave County area, they sequenced about a couple hundred sequences. And yeah, it's 20% as of this month coming back positive for that Delta variant.
Okay, so this Delta variant is more contagious, potentially more severe.
Yes. So, and then what we would like to see is the treatments are basically the same. What we know is that one of the monoclonal antibodies does not show an efficacy against what we're seeing now, but still the best treatment is masking, quarantining the vaccine.
I really can't suggest the vaccine strong enough, irrespective of the dose that you have for fully vaccinated individuals. While it is mildly less protective against infection or transmission of the virus, it is widely as effective as preventing severe infection and requiring hospitalization. So vaccinated, you may still get sick. It will be at a reduced rate. And after a 2-course dose, looks to be about 88 to 92% effective at preventing that infection, but it does reduce your chances of developing severe illness in the upper 80%.
Yeah, and some of the data out of the UK, to be hospitalized, it looks like it may actually go as high as 96%.
Wow. Just a reminder, KRMC is offering free vaccines to anyone 12 and over. Kids under 18 do require an appointment, so to make that appointment, you can call 928-263-3945. Otherwise, if you're over 18, they accept walk-ins Monday through Saturday, 8 a.m. to 1 p.m., and that's at 3116 Stockton Hill Road. That's KRMC COVID Services. If you have symptoms of COVID-19 and need a test, orders from a provider are required. You can get orders by contacting your primary care provider or you can visit azkrmc.com to complete a virtual visit through KRMC Care Anywhere. I just want to thank you two again for being with us and answering some of our questions today. I'm Julia Walters with Kingman Regional Medical Center, and this has been our COVID-19 update series. For more information, visit our website at azkrmc.com/COVID-19. Until next time, stay safe and healthy.